The discussion on post-transplant recurrence usually comes during the discussion in the long case when the examiner discusses about the causes of chronic allograft dysfunction. Because post-transplant recurrence constitute the third most common cause of chronic allograft dysfunction. So the first question will be, what are the common glomerular diseases which recur after transplant? The answer should be primary FSGS, dense deposit disease, PGN-MID, atypical HUS C3GN group, and down the list, IgA nephropathy and membranous nephropathy. What is the percentage of FSGS which recur after transplant, and what is the usual clinical behavior? The average incidence of FSGS recurrence is 30 to 50% with significant graft loss also. And the recurrence usually happens within the first 28 days of transplant, mostly by the end of first week itself. What are the common risk factors for recurrence of FSGS in the graft? One is young age of onset of the disease, less than 15 years. Mesangial proliferation in the light microscopy. Third one is malignant FSGS, means patient reaching CKD G5 within 3 years of diagnosis. The fourth one will be definitely second transplant with high incidence of recurrence. And non-genetic form of FSGS. Why non-genetic form of FSGS have more of recurrence? Answer is presumed permeability factor, PPF FSGS. What are these vascular permeability factors identified yet? One is CLC1, second, anti-CD40 antibodies, third, apolipoprotein A1B, fourth, recently identified anti-nephrin antibodies, and calcium calmodulin serine protein kinase, CASK. So these are some of vascular permeability factor identified yet. What is French protocol in the management? French protocol discusses the treatment of recurrence of post-transplant FSGS, which includes ATG injection, therapeutic plasma exchange once daily for 3 days, next 9 sessions on alternate days, and then weekly 1 exchange till proteinuria undergo remission, along with rituximab. And there is some discussion on changing MMF to cyclophosphamide, 1 to 2 mg per kg per day for 6 months, and high-dose cyclosporin. These are controversial. What is UCLA protocol? This is the prevention protocol, pre-transplant prophylaxis, which includes 10 therapeutic plasma exchange pre-transplant, followed by 3 plex post-transplant, and you give tacrolimus maintaining high C0 level of 12 to 15 nanogram per ml, and give rituximab on case-to-case basis. What is TANGO project? TANGO project discusses the recurrence of glomerular disease after transplant. According to this project, primary FSGS with rituximab and therapeutic plasma exchange, these led to a complete remission in 21% and partial remission in 36% of primary FSGS. And what are the other newer drugs under trial? A combination of obinutuzumab and daratumumab. One. Secondly, anti-CD40 ligand of blasilumab. These are under trials only. And there are CFOG trial, which discusses the role of mesenchymal stem cell transplant in post-transplant recurrence.